These two families represent families in every state house, state senate seat in the state of Michigan. And quite honestly, many families I know have contacted legislators in our state, and certainly we have been hearing loud and clear your cries for help. With that, Dr. Ruth Annan from the Beaumont Center for Human Development is here with us. She supervises behavioral programs for autism and will be of much help to the legislators here when it comes to answering technical questions that the press might have about autism and the research that goes along in the behavioral programs. With that, Ruth Annan.
Good afternoon. When I go to work, I often have to deliver bad news, really bad news. I have to confirm concerns that parents have had for weeks, for months, knowing in their heart that something was amiss with their child. And indeed, in many cases, parents' concerns and worries are confirmed. Their child indeed has an autism spectrum disorder. After I deliver the bad news, we try to segue into some good news. The good news is there is evidence-based treatment that can prove to be a phenomenal help to many children with autism spectrum disorders. We're talking about the difference between living in a state-run institution to being able to live on your own and care for your own daily needs, independence, cooking and cleaning and dressing and toileting. For many children, these are children that with evidence-based treatment that is implemented early on and with sufficient intensity, these kids may be able to be mainstreamed into our public education, may be able to prove to have very productive, successful lives, employment, relationships, families, futures. However, then I have to go back to the bad news. The bad news is these therapies, these intensive, evidence-based therapies that can make all the difference to many children with autism are not covered by most insurances of families here in our state. And that's the point where parents feel like they have nothing left. I've given them bad news, a little bit of good, and then I've ripped the rug right out from under them and told them that they don't have the money, their insurance doesn't provide the coverage for the treatment that could make a huge difference for their child. Some families have left our state because other states do offer this. Occasionally, I will find families that have insurance from other states. Typically, their headquarters of their jobs are located out of state, for example, in Minnesota, and they might indeed have insurance that covers this type of evidence-based treatment. But for the most of the families I deal with, that's not the case. We have treatment at our hospital, at other locations in Michigan that are evidence-based, that are proving to be very successful in changing the lives of children, but very few families can afford this type of treatment. Interestingly, we've had agencies from the East Coast and the West Coast where treatments are covered for the most part and have been for, in some cases, years and in some cases, decades. Come to visit our particular center, particularly interested in a parent training model that we have. Let me back up again. I've talked about evidence-based treatment that, unfortunately, to be effective is very time and labor intensive. We're talking hours. You've heard parents talk about 20 hours, 30 hours, 40 hours. We don't have a magic number, but the researchers do know a lot of time, a lot of effort. Painstaking work goes into treatment for these children. Obviously, that makes it very expensive. To kind of cut costs, to get better bang for the buck, because so many families in Michigan cannot afford to have professionally implemented treatment, we have taken a sort of a backdoor approach. We've taken some parents and trained parents to be the therapist for their child. Certainly, you couldn't find somebody who's more invested than a parent, who cares more than a parent. Actually, most parents are with their child for many hours, more hours than any therapist would ever be. But truly, the reason that we designed our program that way was to cut costs, because a parent can implement therapy more inexpensively than any professional professionally trained clinician could ever do. That helps some families, but for other families, it simply is not a good enough fit. We have families that there is only one parent, and they simply cannot take off the time from their work to be able to be trained in this type of intervention. For others, it's simply not a good fit for their own skill set. We need to be able to have families access professionally trained interventionists and have this covered by their insurance company, just like it is in so many other states. I would like to be able to change my job from having to go in and tell people bad news. Yes, your child does have an autism spectrum disorder. Segue into the good news, but we've caught it early. Your child is very young. There are treatments that are evidence-based that can be very powerful. And then segue into more good news. The final good news is we have these treatments here in our state, and your insurance will pay for it.
Thank you very much, Dr. Annan, for that information. I think we're all enriched for having heard it, and I want to particularly thank Mrs. Husband and Mrs. Brown for sharing your experiences with us here today. At this point, Doctor always calls. At this point, I would like to open it up to any questions from anyone from the media that may be here, and my colleagues are going to stand with me to help us answer those questions. Any questions at all?
Do you know how many states currently have this legislation?
Well, currently there are 17 that have some form of legislation calling for coverage of autism-related illness, but there are another 8 that have introduced bills as well. So, as I stated in my remarks earlier, in Michigan, we have the opportunity to make history here. We can become the 26th state to either have bills introduced or already require that there's some level of coverage. Any other questions?
If there's no more questions, we can open it up for one-on-ones now. I know a couple of people mentioned that they wanted to do that, so I think they're all available. If you want to come up and do your interviews, that'd be great. Thanks.
Well, thank you very much again for coming.
If you didn't get a press release, they're out in front.